You're about to review Full Note Composer for a provider within Allscripts MyWay. The easiest way to open up an existing note for a patient is you can actually come into your incomplete notes section, which is a part of your desktop, or it can be a part of your desktop. You can actually select the date. That's going to open up your Full Note Composer for the patient. What this is going to end up doing is you're going to see that your nurse has actually already started your visit. Typically for a patient, you're going to come into your review of systems. Here's where maybe the nurse has started some of your normals, or you could have documented that. The review of systems is very easy, where you can just check this box to bring in the normals. And then here's where we can come into a certain part of the section. And if maybe they did have some swelling within a certain piece of their body, or let's just actually come into your ears, nose, and throat. Let's say they had some throat pain, sore throat. Here's where you can come in here, scroll down, and actually say the sore throat was present. So it's very easy to document your review of systems by exception. Just like our review of systems, our physical exam will be done the exact same way. So we can come into our ears, nose, and throat. Let's come in here to our certain area. Here's where we can find maybe the tonsil. We'll say it's a tad bit enlarged. We'll say also the right tonsil. We'll say that maybe it's some strep throat. So here's where we can come in, select some of the abnormals, and then we can move into our diagnosis. We talked earlier about our nurse that probably our two biggest talking points that we had was that we use no templates, and then we talked about intelligent navigation. Probably the third most important piece that you have in this system, if not the most, is going to be the adaptive learning. And what adaptive learning is that actually gives the doctor, it remembers the way that the doctor practices medicine. So what this system's going to do is it actually can see that let's just say I'm going to document the problem as acute pharyngitis. Let's just say that I've used that problem before, which I actually have on another patient. On the left-hand side, what happens is I can see how I've actually diagnosed and how I've prescribed that issue with other patients. Benefit is if I'm typically seeing patients over and over again, the same problems. So for example, in the winter, I see a lot of flu patients. I don't know about you, but when I typically saw the doctor, he'd always prescribe some amoxicillin, give me a quick strep test, and have me come back in a couple weeks if it didn't get any better. That happens all the time with providers. And within this system, let's just say that the doctor treats pharyngitis the exact same way. I can actually hit this little checkbox in the upper right, and what that's going to do is that's going to bring in all of that information. So I can bring in my services ordered, and I can bring in when I want them to return. This is actually eliminating the next 4 tabs that I have for that patient. So it's a great time saver. And not only that, it's a way to make sure I don't forget any of those additional procedures, maybe that I forget to bill or I forget to, choose on that patient. Whenever I'm done going through this visit, we can go to our E&M guidelines, and what this is going to do is this is going to take us through the chart note and tell us how many points we've charted in each section. You'll see that each of these sections are hyperlinked, so I can actually just choose that hyperlink and it would take me right back to that tab. We're going to say that the medical decision making was moderate complexive, and it gives us this calculated level of care. So here's a way that we can reduce that risk and not worry about being audited, but more importantly, we want to make sure that we're billing the appropriate level. There's probably a $30 to $35 difference between a level 3 and a level 4, and if you average that out for 30 to 40 patients, you're talking about a serious amount of cash that can be brought in. Not only can you calculate just regular level of office visits, but you'll see you can actually calculate new patients and consults. And then if you do any type of hospital observations or inpatient visits, you have the ability to track those. Once we're done, we're going to hit our OK button. Now that's actually passed our code and we're getting ready to complete our visit and send all this information to a biller. We can come in here, we can go to close our note. That's going to bring up an additional screen where now we're ready to submit our bill, and we're saying that we're done with our note. Once we're done with this visit, we can truly hit our OK button, and we're now done with this visit.